special edition of Cityline. We are looking beyond the diagnosis right now. Please welcome my special guest. We have Dr. Marjorie Dixon here, our fertility specialist. Dr. Gary Rodin, head of supportive care at Princess Margaret Cancer Center, and of course, Cityline floor director JC Chessell joining me here instead of behind the camera today. Well, we know you're a survivor, and I know that we've documented your story on Cityline many times, but what we want to do in this segment is just go beyond the diagnosis, because we know that you're diagnosed, you get a treatment plan, most people think that's it, you're done, you've got your roadmap, but that is only the beginning. Your diagnosis tips off a series of life-altering decisions that have to be made in a split second, and there are many of them. So, JC, what were you faced with when you were diagnosed?
Well, I was shocked when I was diagnosed. Not that I had cancer. I'd already figured that out.
Yeah.
I think for any of us who've been through the process, you get far enough along in it, you're like, chances are not good. They're going to say, okay, go home, have a good day. So that wasn't the shock for me. I think the shock for me was not just having the one decision. Like, this is your treatment plan. Are you okay with it? Yes. I thought that was it.
Right.
But on that day that I was diagnosed, it was also, this is too much information for everyone, I'm sorry, but you know, my doctor took me off my birth control. And for a woman with breast cancer, that's what you do, because 85% of breast cancers are hormone related. So that was the first step, but that tipped off, well, she thought, well, maybe you want to go and look at freezing your eggs. But there's a time frame in there that I don't think any of us had any idea about. And it was, you know, this within the span of 4 days, unbeknownst to me, I had to be in a fertility clinic. And I didn't know that until literally, it was a Monday at 5 o'clock, and my referral had obviously gone to the clinic, and they called me and said, so, you're gonna come see us? And I thought, oh, I don't think so. I thought it was more important in that moment, it was more important to be here to have children, instead of planning for children I may have. So she said, well, we close in 5 minutes. So give me a call back. I called my mother sobbing, do you want grandbabies ever? You need to tell me. I have to know now. I had no life experience for it.
Yeah, it totally makes sense. And even if you did have the life experience, that would be rough. Let's talk about fertility with men and women if there is a cancer diagnosis.
Absolutely. It's interesting about what you say, because I don't think that people are prepared to have that conversation, and that's why it's so important for medical professionals, especially oncologists and fertility specialists, to work together, because it is a conversation that needs to be happening, because there's a very specific frame of time things need to happen in. And even the stopping the birth control pill right away, which makes sense because of the relationship with the cancer, if we can wait 4 more days so that we can give you more of a chance to get your consult in, so that we can use the period right away to get that ovarian preservation possibility there out for you.
Okay.
Because we have this conversation all the time, and we will fit in patients, just like you said, you got come on for an appointment, you have 5 minutes to decide. We don't say that generally, but generally what we say is, this needs to be done in an efficient manner, and we do this all the time. You're not alone, and this is not at the forefront of what you're thinking, but you're young, and you need to have the option of having the conversation.
What about men? Same thing?
Same thing. Interesting that it seems that it's easy to ejaculate sperm. So it's easier for the conversation to happen and to do it pretty quickly, to freeze up some sperm before anything happens. It's important to know that you need to do it before you have therapy, because once you have chemotherapy, radiation, it affects your gonads, it affects the ovaries. And sometimes people after treatment do have the option, and they do well, and they have long survival periods, and they want to have children, and then they see me afterwards, and I think, I wish that I had had a chance to have the conversation in a different time frame.
Right.
So people need to be able to advocate for themselves and know that there are a whole host of support people that exist. There's something called Fertile Future in Canada. There's an online all across Canada to connect oncologists, patients, and fertility specialists together, so the conversation can be had and not too late.
Now, I know something that came up when you and I would talk about what you were going through was just this weird relationship you started to have with your body. Because cancer is happening inside your body, but you cannot escape your body. You can't run away from your body. So you feel like your body is trying to kill you. What do you do about that? I want to talk a little bit about that with you, Dr. Rodin. How do you reconcile that?
Well, it is something unique about cancer compared to other kinds of threats that are more external. And I think the other thing that we're hearing about is the particular issues that come up with a younger person. You know, cancer on average is a disease of older people, And traditionally, cancer centers have been organized around the problems of older people, and we haven't taken into account until recently all of the issues and problems in younger people, relationships, identity, fertility, and it takes planning. And we need to have these services in place. It means we have to pay attention to the person at the same time as we're paying attention to the cancer.
Absolutely.